Antibiotics are used to treat infections caused by bacteria. They work by inhibiting the bacterial growth of or destroying the bacteria. Antibiotics can save lives, but when not used correctly, they can become less effective. Antibiotic resistance occur when bacteria change in some way that reduces or eliminates the effectiveness of drugs. Due to antibiotic resistance, bacteria are able to divide and grow, producing more bacteria that are not affected by the antibiotic. Resistance is usually the combination of poor entry of antibiotics and the presence of enzymes that inactivate or modify the antibiotics given. The overuse of antibiotics has played a huge role in antibiotic resistance, causing bacteria to become resistant to antimicrobial agents through changes or exchanges of genetic material. Exchanges in genetic material occur when two bacteria exchange fragments of DNA known as plasmids. This exchange is called horizontal gene transfer.
Sexually transmitted diseases are serious illnesses that require treatment. The most common STDs are the bacterial infection, gonorrhea, chlamydia, and syphilis. There are about 1.8 million cases of these three STDs each year in the United States. Soon, many of sexually transmitted diseases will be difficult to treat because they are resistant to many kinds of antibiotics. Gonorrhea is a common sexually transmitted disease caused by the bacteria Neisseria gonorrhoeae, which can cause reproductive issues if left untreated. Gonorrhea is already resistant to 11 types of antibiotics. Soon, gonorrhea may become untreatable.
How did gonorrhea become resistant to so many antibiotics? The genetic mechanisms for antibiotic resistance are horizontal gene transfer of either conjugal plasmids or chromosomal DNA, and random chromosome mutation. Early resistance to penicillin was caused by a conjugal plasmid gene, TET-M, which reduced the affinity of the drug. This plasmid did not affect chromosomal DNA and only had minimal effect. The two main mutated chromosomal genes that developed in response to penicillin and now offer resistance to many drugs are MTR, which codes for a transport system that expels drugs from the cell, and PEN-B, which codes for a porin. Mutations in this gene reduce ability of drugs to enter the cell.
Syphilis is an STD which can affect the whole body. Pregnant women who have syphilis can pass it to their fetus. Syphilis can cause blindness, dementia, deafness, and increase the risk of HIV. If not treated, it could lead to death. Syphilis is caused by the bacteria pallidum. The main treatment of syphilis is the antibiotic penicillin. However, there have been cases where syphilis is resistant to this antibiotic. The gene Staphylococcus that's located in the cell envelope, which causes some resistance when binding process of 14C penicillin starts. Most resistance to penicillin in syphilis occurs when reinfections happen or HIV-infected patients. However, syphilis resistance level to the antibiotic penicillin is not as severe as the STD gonorrhea.
How can we prevent the spread of antibiotic-resistant STDs? Let's take a look at the case of gonorrhea, for example. Health practitioners should confirm that symptoms such as urethral or vaginal discharge are caused by gonorrhea before prescribing antibiotics. There are antimicrobial susceptibility tests created from previous antibiotics that can prevent the antibiotic-resistant STDs from being spread. These tests were created to modify previous antibiotics, bringing their susceptibility lower in percentage. But these tests mean nothing if they're not affordable and accessible. But due to some people not being able to afford these tests, they continuously use a higher dosage of antibiotics given to cure gonorrhea. World Health Organization suggests that safer sex practices like condom use and appropriate use of antibiotics when treating infections will help reduce the spread of antibiotic-resistant STDs.